Hi, everybody. Welcome to our Wednesday webinar. Just making sure, again, that everyone can hear us. So if you wouldn't mind just quickly typing into the chat box, if you can hear us okay. George is just now bringing up the presentation. Let us know if you can see the screen. And also, we'd love to know where you're calling in from. So please put that into the chat section. And then also a couple of quick housekeeping things. We do have a second chat section called Q&A on your panel. And if you wouldn't mind typing in your questions in the Q&A box, it'll allow our moderators. We have Shauna and Emily, who are two fantastic educators, and they will be helping to facilitate some of the questions. So if you can type your questions in the Q&A portion, that would be great. And it looks like we have plenty of participants on already, and everyone seems like they can hear us and also see the screen. So it looks like we're ready to go ahead and get started. George, if you want to kick us off.
Yeah, absolutely. Once again, thank you guys for joining us on our webinar today. So the webinar is going to be focused on treating acne. However, it's not going to really be specific to Circadia product knowledge, even though we will discuss the Circadia products and different types of acne that we will treat. The presentation is really going to talk about different kind of causes of acne and then just different reasons on why people suffer from acne on there. But let's kind of go to this next slide really quick. Everybody can see my screen, is that correct?
Yes, George, everyone can see.
Okay, perfect. So kind of let's really kind of go through different kind of causes of acne. So the underlying cause of acne for everybody is always going to be genetics on there. So, you know, a lot of the times, especially when I was in the treatment room and I did a treatment on a client or a client started utilizing a new product, maybe the new product can cause some type of acnogenic reaction on there. You know, they'd always would say, you know, you made me break out. You know, just know that you are not making clients break out, because breakouts, someone that is acne prone is always going to be genetic type of acne. So we're really going to kind of go through some of these different causes, and then we're also going to talk about different treatments on different types of acne as well.
So
Caitlin,
George,
you want to, sorry, go ahead.
I think that's such a good point, and this is something to always remember, especially when you do have a lot of acne clients and you really consider yourself an acne specialist, because acne is such a genetic factor. And we'll talk through all of the different components that are involved in the genetic functions of acne, but you really create a lifelong customer and client really when you're treating acne, because acne really can never be cured. It can only be controlled. So if that's something that we really want to make sure that we're telling our customers and our clients when they do come in, especially in their teenage years with severe acne, is that this is going to be a battle that they're going to continue to have to fight. And it's something that is going to be able to be controlled very successfully, but they can't just say, oh great, my acne has been completely eliminated, I can go back to not doing anything. This is something that they're going to continue to have to focus on really for the rest of their life, because we have different hormonal changes that are occurring in different stages of our lives.
So kind of the first category that we'll get into, like we mentioned before, so all acne really comes from genetics. So there's two different things to consider when you're thinking about that genetic type of acne. One of the biggest things is going to be that retention hyperkeratosis. So whenever you're looking at the stratum corneum of the skin, or whenever you're looking at the skin, it doesn't just stop at follicles. We'll have a slide where I'll kind of show this a little bit more. So your skin cells, they're constantly kind of coming up to the surface of the skin. However, just note that those skin cells, as they're coming up to the surface of the skin, they're also shedding into those follicles as well. So as they shed into the follicles, if it's overly excessive, that's what can be considered as that retention hyperkeratosis, which is also going to be genetics on there as well. So I definitely recommend to just research retention hyperkeratosis. You know, a lot of the times when you kind of Google it, you'll see something that's going to be at the extreme level. However, it doesn't necessarily have to be at that extreme level on there as well. Another thing to take in consideration is a skin type, which is someone's oil production. So the other thing to kind of take, know, or like an analogy about oil production. So whenever you see oil, oil is always going to come to the surface. So if you had like chicken broth, or even if you had something like that, you know, something where you kind of had like any type of bone broth and you put it in the refrigerator, you'll notice that the oil always comes to the surface. So kind of think of that as what's happening in the follicles of your skin cells as well. So when you combine that retention hyperkeratosis with someone that has overactive sebaceous glands, that oil active is going to come to the surface and it hardens on there as well. Caitlin, do you want to add anything onto these two?
So, and unfortunately, for those who do suffer from acne and from some of these genetic components, it's not only just the increase in oil production through the sebaceous glands, but the actual sebaceous glands are larger. So they have more ability to excrete oil through this process. So you're really fighting the oil from two different perspectives. It's excreting additional oil, plus your oil glands are larger with this genetic predisposition.
All right, next slide on here. So another thing that you have to take in consideration is hormonal or hormones. So whenever there's different hormonal fluctuations that happens in the skin, this can happen for many different reasons. We can have the premenstrual, we can have different birth control that a client is on, but the main thing is what's gonna happen is different abnormal hormonal fluctuations in the skin. What happens is it's gonna increase testosterone. Whenever testosterone increases in the uptake of the skin, that's when there's a potential for more oil production as well. So other things to kind of take a look at is going to be pregnancy. Some actually women will see their skin may get a lot better when they're pregnant, where some of the clients in the first or second trimester, they see an increase in those breakouts as well. Another thing is like menopause, then we have stress and also diet. So whenever you're looking at diet, so, if I were to eat this is a huge myth. So a lot of clients out there, they think if they eat something like a Snickers bar right now, in the next hour or so, they're going to break out. Unfortunately, that's not how it works. When you're talking about diet, this is something that has a bad diet for, weeks on weeks at a time. And that's what can also increase different hormones in there. And it's also the way that our foods are processed. So like cheese, for example, so dairy or cheese isn't really going to cause the acne, but it's the way that it's processed and there's different preservatives and stuff that's in there, which is going to actually cause the different hormone fluctuations into the skin as well. So I know a lot of us has probably been, I know my diet has completely changed since we started social distancing. And then of course I started to break out because I added a lot of processed foods to my diet as well.
Right, and it's a lot that has to do with the processed foods. There's also some research out there where high carbohydrate diets, mainly like your white flour, your white sugar, things that are really good and tasty. Those are the things that are also not great for acne. But really, as far as dairy and meat are concerned, what we're really focusing on here too is the different hormones that are injected into the cow that can also trigger specific forms of acne. So it's twice removed, but it still has something to do with the amount of acne that you're seeing on the skin. And the diet and stress and then all of these other hormonal aspects, all of these trigger your sebaceous glands, as George had mentioned. It's more of your androgen dominant hormones that are creating more of the testosterone and the more testosterone uptake, and then also excreting additional sebum into the skin. So one of the things that I think is really interesting, and this is, I think, for most people or women on the call right now can relate to, is any premenstrual breakouts. So about 7 to 10 days prior to your period arriving, a woman's body will have an increase in progesterone, which is considered to be a male dominant hormone. And that's because the body is getting prepared for the fertilized egg to basically implant. But it also will trigger additional oil production in the skin. The progesterone will trigger more oil production. So it's important, if you have a tendency to break out around your menstrual cycle, you usually break out before it happens, and that's due to the increase in progesterone. But they're also, at least from my personal experience from a lot of the patients I'm treating, they're really deep under the skin. They can be very painful. There's a lot of pressure that you feel, and then unfortunately they never really come to a head. So being able to proactively pre-treat, knowing that it's usually those 7 to 10 days before your menstrual cycle comes, and really pre-treating with things like Spot Stop or even daytime control that can help to decrease that testosterone uptake in the skin. Those things are really important. And when you're talking about birth control is a huge reason why we see a lot of breakouts, especially in your, young adult women. And it's because there's a lot of birth control out there that are androgen dominant. So you might see minimal change with acne for the first 2 months when you're placed on an androgen dominant birth control, but most of the time it will clear after 2 or so months. But you'll see an increase in the acne when the client is removed from birth control. So it's not just when they're on birth control, but it also has a lot to do. You'll see some flare-ups when they're pulled off of that particular birth control as well. And then as far as pregnancy, yes, you'll have some women who will say that they have the best skin of their life and everyone says that they're just glowing. And then you'll have other clients who say that they have the worst skin. And unfortunately with pregnancy, there's a lot of contraindications. So we really like to err on the side of caution with Circadia at least, and things like your BPO, your salicylic acid, all of those things, even your standard AHAs, we see as being contraindicated for somebody who's pregnant. So there's really not much you can do as far as treating your pregnant clients who are facing different issues with their skin. But broad generalization, during the first trimester, you have higher levels of progesterone, which we talked about, and you also have higher levels of HCG. And that can lead to an increase in acne. Most of the time with most of your clients, towards the latter part of pregnancy, estrogen starts to increase and that can start to decrease some of the acne. And then post-pregnancy and nursing, obviously your hormones are continually fluctuating and that can also lead to certain breakouts. So poor George, he has all this info, but sometimes, he can't really talk too much about menopause and menstrual cycles and things. So it's very interesting information. But these are all of the different hormonal pieces that are involved in acne.
Right. Thank you, Caitlin, for going through all of everything that women go through. And then unfortunately, men do not on there. So the other thing that we're going to now to take a look at is going to be the P. acne into the skin. But before we look at that P. acne bacteria, I really wanted to, so I know earlier I mentioned how like the stratum corneum and also the epidermis, how it doesn't just stop when it gets to a follicle, how it actually goes down underneath that kind of underneath the sidewall as well. So if you're looking at this image right here, so this is going to be the epidermis. So notice how it comes all the way down and underneath the bulb of the hair right there as well. So our skin cells are constantly coming up to the surface. So they're constantly regenerating themselves as well. So typically our clients in our mind, they don't really think that they kind of come in here and blog that follicle. What they think is it's just coming up right here. So earlier we were discussing that retention hyperkeratosis. So retention hyperkeratosis is these keratinocytes are not only shedding up, they're also shedding down into the cell right here as well. We also mentioned how hormones can cause an increase in testosterone that's also going to increase oil production. So that's going to be your sebaceous glands right here as well. So as your sebaceous glands are kind of pumping oil up into this follicle right here, and someone does have that retention hyperkeratosis, it's going to clog and it's going to block this passage right here. So if it clogs and blocks this right here, what's going to happen is there's no oxygen that's going to be able to control the P. acne bacteria. So, we have healthy bacteria, we also have unhealthy bacteria, and all of that is going to be down here as well. So that's when that bacteria is going to start to now form and start to digest the oil that's going to be in there as well. So bacteria's only food source is going to be oil. That's going to happen in there as well. So this is also part of the skin's microbiome on here as well. Caitlin, do you want to add to that?
I'm sorry. No.
All right. Did you, on this next slide, do you want to discuss the inflammation immune response, which is now going to lead us into the acnogenic versus cometogenic acne lesion?
Sure. So, and again, as George had mentioned, P. acne bacteria. So if we're taking this from a progression standpoint, we know that you have those who are prone to acne have retention hyperkeratosis. They also have more sebaceous secretion, and they have larger sebaceous glands. Now you have all these different hormonal factors that are contributing, that are increasing the amount of sebum that is being pumped into the follicle. And we know that P. acne bacteria loves sebum. It's its favorite food source. You've created an anaerobic environment with retention hyperkeratosis. So everything follows a very specific pathway. And then when the P. acne bacteria comes in, it basically will look at the sebaceous material as its favorite food source, and it breaks down the oil into fatty acids and glycerol. So it's mainly the fatty acids that actually start to irritate the follicle wall. And over time, that irritation can actually create an issue where there's so much inflammation that the only response of the skin after the wall ruptures is to bring in different cytokines, different messengers that are going to basically trigger these neutrophils to come in. And think of these as your first responders. So they're going to help to wall off the infection, and it's going to start to digest the bacteria, but that then in turn is going to increase inflammation. So now you have additional inflammation. Your white blood cells are also going to come in, and those are accompanied, of course, by your red blood cells, and that's what's creating those traditional red papules. So again, I know it seems like a lot of information, but everything follows a progressive path from the very beginning through then when you see an actual red papule on the skin. And then when white blood cells eventually die, they become the pus that then turns into a pustule. So I think, you know, now just talking through this, George, we should make like a little chart that kind of shows the flow of an acne lesion, because I think it's really important. Each one of these steps plays a big role in what you're actually seeing on the skin, and then knowing what each role has, we can address each specific portion of this pathway.
No, I think that would be great on there as well, if we can create something like that to really show, you know, I'm more of a visual type of learner versus just kind of words on a presentation. So that's definitely something we can work together and make for everybody as well. So this next one, the anatomy of an acne lesion, it pretty much just sums up what we were kind of talking about there. So, you know, we were talking about what's going to form that acne lesion on there. We'll have to create a better chart to kind of show you guys the progression of that comedone now to a pustule to a papule, onto the client's skin as well. But as you're kind of looking at this, kind of to summarize what myself and Caitlin were briefly discussing on there is, so what's going to kind of clog down this follicle right here is going to be the excessive cellular debris. So this can actually get clogged down in a couple different ways. So it can be something that is genetic, which we were talking about, like that retention hyperkeratosis, or someone that has those overactive sebaceous glands on there as well. But something else that can actually clog the skin down is we have what can be considered as an acnogenic reaction, or we have something that can be considered what is going to be a comedogenic reaction on there as well. So that acnogenic reaction, pretty much what's going to cause the acne lesion is inflammation. So this can possibly happen about 3 to 4 days after the use of a product. What can possibly happen is it didn't really clog down the pores. It's just that the skin did not like that active ingredient. Typically, it's something that's more of an acidic type of ingredient. For example, like traditionally like L-ascorbic acid, so that type of vitamin C sits at a really low pH, which could be pretty kind of irritating on a lot of clients' skin. So you put a client on this L-ascorbic acid, which, you know, you believe vitamin C is beneficial for everybody, everyone should utilize it. However, that L-ascorbic acid is going to be sitting at a very low pH that's going to irritate the skin. So the L-ascorbic acid, it's not comedogenic, but it's going to kind of make the skin look like it has these breakouts because it's causing inflammation. So once you look at this kind of head right here, you apply something that's irritating and aggravating on the skin, causes inflammation. That's what's going to close this follicle wall on here, but it's also going to close the other ones that are going to be next to it. So as we close this follicle wall, that is now what's going to start to create those pustules and papules, because now we have those skin cells that are going to shed into itself. The oil production, the P. acne bacteria, that's going to happen on there as well. We can also get reactions that are going to be considered those comedogenic reactions as well. And a comedogenic reaction is differently, it's pretty much different ingredients, like different emollients. There's also different ingredients that kind of add slip to a product that could potentially clog the pore down as well. So that's another way. So you really have to start to identify if you're dealing with someone that is getting acne from an inflammation standpoint, or if you're getting acne from somebody that has using the wrong product. When you think about someone that's using the wrong product, I know in our mind, we think, you know, after 2 days, we're going to see a breakout. But unfortunately, that's not how the skin works. The skin has to be utilizing this comedogenic product for at least 2 to 3 months before you're actually going to start to see these breakouts. So you want to start asking questions, not really questions like, what have you started using in the last day or two? What did you start using different about a month, 2 months, 3 months ago? And that's what's actually causing those different breakouts on there as well.
Right. So each of these ingredients that you, and a lot of companies, you know, they talk about the skin purging, and sometimes there's a misconception that you're seeing this acnegenic reaction and it's being viewed as the skin purging, but it's not necessarily the case for some people. As George had mentioned, if an ingredient is irritating or inflammatory to the skin, same thing that happens if you hit your thumb with a hammer, your thumb is going to swell. If you're using for, you know, extended periods of time specific ingredients that are creating inflammation, that's what's swelling the follicle shut and creating that anaerobic environment. And just as George mentioned, that's kind of the trigger that starts all of the progression of the other steps that are part of an acne lesion. So those are things to remember. You want to make sure that, you know, is this a purge or is this a reaction to a particular ingredient? And then also to keep in mind too, that if you feel like it's an allergic reaction, you have to remember that the skin has to be exposed to a particular ingredient multiple times in order for the histones to build up in the skin and create a reaction. So a lot of the times it can just be an irritation, which is more of an acnegenic reaction, versus an allergy that is something that has built up enough histones in the skin to create an issue. So I know we have a couple questions that have come in. Shauna, is there anything that needs answering?
I was just letting can acne can be reversed or control if it can be treated epigenically. I was just waiting to see if you were to talk about the product, so I wasn't sure if you wanted to answer that now.
Sure. So, I mean, with epigenetics, there's so much unknown, and there's so much research that's being done in the study of epigenetics. It's interesting. I was just listening to a documentary the other day about epigenetics and how even in utero, some of the things that we see later in life, like different ailments and different diseases, et cetera, that are being seen, have had changes that are happening in utero. But there's not a specific ingredient that I know of that can actually remove some of the tags on your histones that are related to retention hyperkeratosis or something like that, that could possibly cure a hereditary form of acne. So I'm sure there's much more information out there that maybe we're just not aware of, or if you have a particular ingredient that you think would work towards that, we'd be happy to look into it. But from our understanding, there's not anything that is targeted specifically for that.
Another thing that I wanted to add to this acnegenic reaction on here as well. So, you know, you may have done different kind of stimulating treatments on a client and they have now have these breakouts. For example, like chemical pills, you know, you do a chemical pill on a client and you may see these breakouts that are happening. So these breakouts, I know we've always been, been told, it's purging, but that possibly can be also an acnegenic reaction. It was too stimulating for the client. It had created that inflammation. Now that it created that inflammation, that is now what has clogged those not clogged the follicles, but kind of closed them down a little bit. And that's what's going to create that environment where oxygen is not going to be able to kind of penetrate into that and kill that P. acne bacteria. Typically it goes away pretty quickly on there, but just know and let your clients know that this is something that can happen. Every time I treat a client's skin, I do say that there's a potential that your skin will get worse before it gets better on there. And it's all about having those realistic expectations when you're first initially starting to talk to your clients. And it's also this acnogenic reaction can also just pretty much be anything that's stimulating. So like essential oils, some essential oils can be stimulating as well. So you really want to look at your product line and make sure there's no stimulating ingredients that are in there to make the product cosmetically pleasing. A lot of the times essential oils are used as a fragrance system, not really that there's any therapeutic benefits, but because it smells nice. So sometimes some clients can be sensitive to those different essential oils because they are stimulating, and that can also create that acnogenic response as well. One of the biggest thing, which you've probably seen, a lot of clients are utilizing facial masks now. So these facial masks is creating pretty much like a battleground for different types of acne on there as well. So the acne that we're typically seeing is acne mechanica. So acne mechanica, it's characterized by excessive heat, sweat, rubbing, just pretty much a lot of friction. Wherever there's a lot of friction, that's what's going to create a lot of these acne lesions or these pustules or these papules. So now I've seen a lot of my clients having a lot more these breakouts or these acne lesions in these facial masks because of the facial masks that people are having to wear right now.
Yeah, this is such a relevant piece, and this is new information that we're talking about here. But this is the acne mechanica is not necessarily new. It's really common in athletes. So if you've ever treated a teenager who, their head's in a helmet all day long and their forehead starts to break out because of the pad on the helmet, or if they're wearing shoulder pads or straps or whatever, and you notice that they have a tendency to break out on their back because of the shoulder pads or something, it's that constant friction and constant moisture that's creating this particular form of acne, which clearly with wearing a mask, especially if you are, required to wear it all day, your, breathing is obviously creating moisture. And then you have the friction of the mask, especially if the mask is a little bit too tight, that can definitely create this acne mechanica.
Yeah, so it's pretty much, it's really big. You're going to see a lot of clients now that's going to have these acne lesions, especially now that we're starting to open up. A lot of places it's mandatory to, even when you're getting a facial, that you as the provider has to wear a facial mask, but also the client has to wear a facial mask up until the time that you do the treatment. There's also some states where, they're not even opening it up to do facials, where they have to keep that mask on there as well. So where you can really start to treat these clients is now with going to be home care products. If they're not going to be able to get facials, really start to look at what can potentially happen in the next couple of weeks, couple of months from these facial masks, and start to retail products that can help to reduce the friction, something that can actually cool the skin down. We donated a lot of our post-pill balm to a lot of hospitals and nurses. A couple different things that the post-pill balm was able to do. It relieved a lot of discomfort, but it created that barrier and it cooled the skin down as well.
Yes, exactly. So one of the first things that you'll notice with this maskne or acne mechanica is rough bumps. So first you'll feel a textural difference in the skin before you actually see a visual pimple or pustule. And then over time, if untreated, those can turn into deep cystic lesions. But it will start off as just that rougher texture, and you'll have more of a feel versus a visual. And yes, the post peel is fantastic. It's great for preventative, especially if you're in that rough bump texture phase. But we have to be careful too, because a lot of the things on the market that are designed as protection also trap in moisture. So if we already have an increase in moisture and friction, we want to make sure that we're using the post peel not underneath the mask, but more at night once the mask has been removed. Things like the aloe mist can also be a great option to help once the mask is removed, and then you can start to heal the skin. So we've talked about the acnogenic reaction, the acne mechanica. Another form of acne that we don't talk too much about is neonatal acne. Neonatal acne is something that my son personally suffered from. And one of the reasons that I got into aesthetics originally is because I myself suffered from acne when I was a teenager. My forehead was just completely covered. And of course, my solution was to get bangs to cover it, which only perpetuated it worse. And then, it was a really big struggle for me. So when I had my first child, he developed neonatal acne at a pretty young age. I think he was probably like 2 weeks old. And it's just, unfortunately a glimpse into their genetic predisposition for acne. So it usually occurs within 2 weeks of birth, and it will usually normalize and clear on its own by 12 months. And then a lot of that has to do with the mother's hormones, also depending on if they're nursing or not. But it's something that, if you get the question about neonatal acne, the best thing is really not to treat it. If you can treat it with like breast milk or something very, very gentle, but it usually has a tendency to clear on its own.
So not a Jesner pill.
Right, exactly. No salicylic acid for your 2-week-old.
Okay, yeah, completely makes sense. So just kind of to summarize where we're at, so we really started to really discuss more of like the different causes of acne on there. All causes of acne starts out from genetics, but there's also different factors that can go into play, whether it would be that increased cell turnover. It's also going to be oiliness, different hormones on there, the P. acne bacteria, also inflammation can also cause acne on there as well. But now we're going to kind of get into now the different grades of acne as well. So here we have this set up in a couple different ways. So the first way, we have a chart on here. So if you have that chart, if you take a look at a grade 1, typically just a little bit of comedones, whiteheads, blackheads, there's not much on there. Typically it's going to be less than 25 lesions. I say less than 10 on there. Then you got grade 2, where it's just going to be your grade 1, all of those comedones, except now you're going to have the plus inflammatory papules. Grade 3 is going to be the pustules and more inflammation. And then grade 4 is going to be the cystic inflamed acne on there. So us as estheticians, in our scope of practice, we only work with the grade 1 and grade 2. I have seen some estheticians out there who are working on higher grades of acne if they are paired with a doctor as well. So here's also some visuals. So if you kind of take a look at this grade 1 right here, so, just a little bit of blackheads on there. A main thing you do see is something like discoloration. So some ways to kind of treat this type of acne, you want to remove that cellular debris, so exfoliation, like our cocoa enzyme is amazing for this. I would even do a salicylic acid peel on this client as well.
Yeah, for sure, George. I would too, because you're not seeing much active inflammation, but you do see a bit of post-inflammatory pigmentation. So, there's a time and a place for more of our aggressive treatments, like our Dermafrost peel or our Mandeli Clear peel. And if you can get a client in and they can be compliant with their post-care, et cetera, this is a great time to be a little bit more aggressive than just our standard cocoa enzyme oxygen, where you can really start introducing things like a Dermafrost or a Mandeli Clear peel to really jumpstart your treatments. And then you can pivot to the cocoa enzyme oxygen later or in between, but this is a great candidate for more of those aggressive treatments.
Then just a visual on your grade 2 on there as well. So kind of follow a similar kind of treatment plan to my grade 1 on there, but it's all based on the amount of inflammation. So whenever you're treating an acne client, you always want to take in consideration the amount of inflammation that's associated with that client. So you'll notice the woman here on the right, there's a lot more inflammation compared to the woman there on the left. So I would actually have 2 different treatment plans for these clients on here as well. You'll also notice the one on the left is a little bit more oilier in kind of an appearance on there compared to the one on the right. Also, I am noticing the one on the right is also a little bit more dehydrated as well. So I would be more likely to do a chemical peel on the woman that's there on the left versus the one on the right. The woman there on the right, that's where my treatment plan would start with a lot more anti-inflammatory treatments. For example, with your anti-inflammatory treatments, I would do cocoa enzyme on this client. I would do oxygen on this client as well. I would even do some firming peptide mask on this client, but we'll talk through those regimens when we get down to the end of this slide as well. Then of course we got the grade 3 on here as well. So typically we don't treat any type of a grade 3 on here, but just notice it's between 7 to 100 lesions on here. There's going to be bacteria that's on here as well. One thing I do want to notice whenever you are, I want you all to notice is whenever you are treating a higher grade acne, pay attention to facial features on a woman clientele. If their facial features are a little bit more masculine, then you can tell this is going to be more of a hormonal type of acne to address or to treat. So you'll know you want to put them on products that are designed to decrease oil production on clients also.
Yeah, Dr. Pugliese did quite a bit of research on androgenic face typing, and it's incredibly interesting information if anyone's interested in some of the studies. I think that we actually have some of them in the office, but if you do have clients that have more of a masculine facial structure, then you know that there is more of a testosterone uptake, and then you can start to present your protocol and your home care specific to that hormonal aspect. But these are certain cases where, you know, you're seeing so many open and closed papules and pustules. You're seeing a lot of red, really inflamed nodules, lots of, you know, cystic lesions and tons of inflammation. This is a great person to introduce icing to. We don't talk about icing too much, but when you see so much inflammation, not only is it going to help to alleviate some of the discomfort that they have, but it does also really help to reduce some of the inflammation.
Then there's the grade 4, which is definitely never going to treat as an esthetician on here, definitely refer to a physician or a doctor on there. So their treatment plan can typically be different medications that they'll put them on, whether it'll be topically or also taken internally as well on here. So always recommend that these clients that you see to a dermatologist or even their physician to address or treat as well. So now let's really kind of talk about treating acne before we get into the products. So there's always, you know, so Caitlin had mentioned at the start of the presentation that every acne client that you get is going to be completely different. So if you got amazing results on one acne client and then you tried to follow that same kind of blueprint on another acne client, it may not be the same result that you're looking for as well. So whenever you're going to address an acne clientele, like we had mentioned a second ago, you want to determine your treatment plan based on inflammation. The more inflammation that is going to be associated with that particular client, the first thing you want to address is inflammation. So a lot of the times I will start to pull in products from the Cercidia Sensitive Rosacea Reactive line into my acne clientele. One product that's really amazing for acne, especially inflamed acne, is going to be Chronocalm Serum. So Chronocalm Serum can do a couple different things for that inflamed acne. One of the biggest things that it does is it provides almost an analgesic effect to the skin. So it's going to numb the skin out. It's also designed with vasoconstrictors, so it's going to decrease redness, and it's also designed with anti-inflammatories. So Chronocalm, not that there's anything in there that's antibacterial, but what it's going to provide for that inflamed acne, it's going to decrease discomfort. It's going to help to rehydrate the skin. It's also going to help to reduce the redness, reduce the inflammation on a client's skin as well. So you'll notice with a lot of our treatment regimens, if it's an inflamed acne, we will pull the Chronocalm or some other of our sensitive products into that area as well. Once you determine the amount of inflammation that's associated with a client, then there's another starting point that you have to kind of take in consideration. So maybe some clients may need to normalize desquamation. So maybe for this client, they have a very slow cell turnover. So we have a more mature clientele that's now starting to break out when they didn't break out when they were younger, and it's because their cell turnover cycle is going to be much slower. So what you're going to want to do is put them on something that's a nightly exfoliant. So like the Almondola Milk Cleanser does have mandelic acid, lactic acid. So that's something that I apply for my clients if they're more of a mature type of clientele that's now starting from breaking out because now they have that slow cell turnover cycle as well. Another thing you'll have to take in consideration is bacteria. So in our full entire acne line, we do provide antibacterials in the whole entire line on there as well. Another thing is you want to promote healing. You'll also want to slow sebaceous activity, especially if they're more of an oilier clientele. And then you also want to eliminate and control your congestion on the client's skin. So extractions are amazing when they are done properly in the treatment room. We never want to have our clients do self extractions. I know they're going to do it behind our back anyway, but we also want to never, doing extractions can be amazing on a client's skin, especially doing extractions and icing the client's skin as well. Caitlin, do you have anything to add on this one?
I don't, but truly my missing link, especially when treating somebody with a lot of inflammation, was the chronocalm. It was such a game changer for, making sure that we're not taking 2 steps forward and 1 step back if we're over aggressively treating them. So pre-treating with the chronocalm for 3 to 4 weeks before you even have them come into the treatment room to have any sort of a procedure done, it works wonders. And the chronocalm is our #1 choice versus the Tranquility Cream. The Tranquility Cream is great. It is in more of a cream base, which, if you're also looking at a lot of excess bacteria and sebaceous activity, you don't necessarily want to go that route, versus the chronocalm, which is in a really nice pharmaceutical grade hyaluronic acid. And the Tranquility Cream also is really dealing more with inconsistencies in pH and really helping to address the itching factor that's associated with rosacea flare-ups that are happening, with your circadian rhythms. So the chronocalm is really directed more as an anti-inflammatory versus the Tranquility Cream. So that's the main reasons why we chose that product versus Tranquility Cream to help to treat acne. But again, if you are stuck and you are frustrated with your regimen and you're not quite sure where else to go, adding in the chronocalm is something that is seen to be very beneficial.
Shauna, Emily, do we have any questions? I think this is a good place to pause before we get into the product knowledge portion of the presentation.
There isn't any open questions.
No, everything's been answered in the chat?
Yes. Mm-hmm.
Okay, so now the next portion of this presentation, we're really going to talk about the Circadia acne range, or just the products that are typically in the acne category. But however, do note that we do have products that can be utilized in an acne setting. For example, we have a product, we talk about the chronocalm that's in our sensitive category, or the sensitive range. We also have some retinols. We have a vitamin A gel that can be very beneficial to an acne client. But just note, whenever you're utilizing any type of retinols or any type of vitamin A's on an acne client, the skin will get worse before it gets better. And it's because it's starting to increase that cell turnover and can possibly be irritating, which is now going to create that acnogenic response on there as well. But however, if you do have our tech manual, or if you looked on our website, we do have products that are specifically in just an acne category or an acne range on there as well. So the first product that we are going to discuss, it's going to be our cleanser. So we do have multiple cleansers that can be used in an acne setting. I mentioned briefly the Almondola milk cleanser. That's really beneficial for a dry acne, or somebody that's a higher Fitzpatrick that also is going to suffer from any type of post-inflammatory pigmentation post an acne lesion. We also do have our honey cleanser that can be used in an acne setting. The way that it's going to benefit acne is the honey is going to be antibacterial. However, it's also going to be a gentle exfoliating cleanser. However, what you'll see in the acne range is the cleansing gel with salicylic acid. So we are utilizing a 2% salicylic acid that's going to be in this formulation. So think of this as your beta hydroxy acid cleanser. One thing I do want to note is that this cleanser, it's retailed in a 4 ounce, whereas the rest of our cleansers are retailed in an 8 ounce. So the reason why it's retailed in a 4 ounce is because it's designed to be used half the time. So typically we don't recommend to use this one as a twice a day daily cleanser, because salicylic acid is also going to be oil loving. So we don't want to strip the client's skin. We don't want to reduce every single oil that's in a client's skin. However, utilizing this every other day or even twice a week can be very beneficial to a client's skin.
I'd also say too, George, because you had briefly mentioned the vitamin A gel, and I think it's probably in this presentation, but the vitamin A gel is basically a 1% retinol, and it does have a tendency to make the skin look worse before it can get better. But using the the cleansing gel, I would highly, highly recommend your client uses the cleansing gel with salicylic at the same time, because the cleansing gel with salicylic can help to remove the keratin plug that's kind of holding all of the excess skin cells from the retention hyperkeratosis, but also from using the vitamin A that's kind of accelerating that cell turnover. If you can remove the keratin plug, you can allow for that impaction to come out easier. And that's what the cleansing gel with sal can do, used every other day. So I would say that those are a perfect pairing if you do decide to go the route of a vitamin A in your acne treatment.
Yeah, another thing I do want to mention about the cleansing gel with salicylic, it's amazing for body acne. So I highly recommend to start offering body treatments, especially now that we're post kind of, we're starting to get back into the treatment room as well. Especially if you're dealing with a lot of clients that work out a lot, or someone that's always constantly at the gym as well. So people that are working out quite a bit, they are suffering from body acne, and they really want to get rid of it pretty quickly. So the cleansing gel with salicylic, it's great as a back treatment to start out as a cleanse for a back treatment, but it's also amazing to retail for as a body cleanser for any type of back acne as well. One of the reasons why I did mention it's great for people that kind of work out as well. So people that are working out, or these bodybuilders, someone that is constantly, what's happening is they're typically wearing clothing that's really restrictive and tight. Then they're starting to kind of sweat, and then they also are typically taking different supplements that are designed to increase testosterone, which is now going to increase oil production. So people that are constantly, really working out a lot, they are having the sweat on their restrictive clothing that's now causing the acne mechanica, which is that friction we talked about a little bit earlier. But the other thing that's happening, there's an increase in oil production, and there's also an increase in bacteria. So utilizing cleansing gel with salicylic is amazing as a body cleanser to treat any type of acne lesions. We also have a lot of clients that utilize the cleansing gel with salicylic acid as a body cleanser for pigmentation. The reason, or the way that it's going to treat pigmentation, is by removing those surface proteins, or removing those keratinocytes that's housing the melanin in them as well. It's not that this is going to slow down melanin production, but what it's going to do is remove those surface protein that's housing that melanin production. So the next product that we have in kind of the acne range on here is called the White Willow and Juniper Clearing Mist. So the White Willow and Juniper Clearing Mist, it's one of our functional mists. So I'm sure many of you are familiar with our functional mist. It's kind of our version of a toner. So, we don't have any cleansers that are designed to kind of take the pH of the skin where you'll actually need a toner to retone the skin. But we do know it's industry standard to have a similar product. So what we have is our functional mists. So we have 4 functional mists for 4 different skin types and skin conditions. What our functional mists are designed to do is just be an extension of their treatment. The White Willow and Juniper, it's designed to provide anti-inflammatories, but at the same time, kill that P. acne bacteria without drying the skin out. Typically, kind of in the kind of aesthetic industry, the way that we've been trained to treat acne lesions is by pretty much drying the skin out. However, drying the skin out is now going to lead to additional inflammation, which can lead to additional breakouts. But the other thing, it's also going to lead to those acne pick scarring. So, with the White Willow and Juniper, it's going to effectively control that P. acne bacteria, reduce inflammation. However, it's also going to help to be hydrating on the skin to provide natural forms of salicylic acid with this, or natural forms of hyaluronic acid and salicylic acid that's going to be in here as well. We do say this is really good for oily, acne-prone, dry acne, teenage skin. However, it's really good when you cannot cleanse your skin. I have a lot of clients that will take this with them. Kind of think of it as like a gym bag essential. Keep it in the gym bag, and if the client is not going to wash their face after they work out, this is great to spray and just wipe it with a 4x4 till they can cleanse their skin as well. It's also great when you're going camping. Any time when you don't have access to water to wash your skin, the White Willow and Juniper Clearing Mist is going to be ideal for that as well.
And we've been talking so much recently, obviously, about not touching our faces and making sure that we're, not touching around our mouth and our nose area. And we've been, hopefully, over the past 3 months, really training ourselves to not do that. And so in a gym setting where, prior to COVID, we still were seeing, high cases of bacteria, staph, etc., was living in a gym setting. So these are great to keep in your gym bag, but also for your teenage acne. There is, there's only so much you can request of your teen acnes to follow as far as a regimen. So something like the white willow and juniper clearing mist that can be sprayed on multiple times a day. It's an easy application. They can keep it in their, their locker. They can keep it in their backpack. They can spray it on in the morning, in the evening, however many times they want to. It's a really great product to introduce to your teen acne, to get them accustomed to using more professional products. And it's also easy application.
All right, so then the next two products we have a product that's called daytime control, and we also have a product that's called nighttime control. One thing to note, these always don't have to be paired together. And the other thing is your daytime control can be applied twice a day. It doesn't have to be applied just in the morning time. For those hormonal acne clientele, especially your younger teenage skin, you really don't want them on like a harsh benzoyl peroxide, a harsh salicylic acid. So sometimes for their regimen, you may have them apply daytime control twice a day on there as well. So the daytime control, it's really designed to do a couple different things onto the skin. One of the biggest things that it does is it's going to help to kill P. acne bacteria. As it kills the P. acne bacteria, it's also going to address inflammation in the client's skin. But one of the key benefits is it has an ingredient in here that's called Regusep. So Regusep is actually designed to decrease testosterone uptake in the skin. So as we decrease testosterone uptake in the skin, that is now what's going to decrease oil production into a client's skin on here as well. Some of the ways that you can kind of sell the daytime control to a client's, you can definitely retail it for just their acne. A lot of the times I really like to retail this to someone that's more of an oilier type of skin as a mattifying moisturizer. Utilizing just different words like that will help to kind of retail the product, and they'll realize that it's going to help to decrease oil production, and it's going to mattify their skin as well. Another way, we do have a lot of clients that use this as a makeup primer. So if you're not part of the Circadia Educational Forum, we had a question in there recently, and what the question was is what can be utilized as a makeup primer? So the best makeup primer is healthy skin. So there's nothing really on the market that is going to be better than healthy looking skin as a makeup primer. So, when a client comes in and they say, I want something that's a makeup primer, put them on one of your clinical grade skincare products that's designed to be more corrective and not just something that is going to give the look and feel of a kind of plumped up skin or oil production. So daytime control can be retailed as a makeup primer or a mattifying moisturizer to decrease the oil production, but it's also going to be very corrective on a client's skin as well. Hey, Caitlin, are you there?
I'm here, yeah. So this is, I would say this is probably my favorite and my go-to product when I'm prescribing products for acne, because it has such a stacked ingredient deck. The lilac stem cell extract on its own is incredibly powerful in its anti-inflammatory potential. And then also when when someone comes in and they are going through their consultation and they're saying that, they're really unhappy about the acne that they're experiencing, and then when you actually go to do your skin analysis, you're not seeing as many active lesions, but you are seeing some pretty bad post-inflammatory pigmentation. You want to be able to treat both, and you want to be able to treat both successfully. So we have niacinamide in this product that's going to help to decrease some of that post-inflammatory pigmentation, but then it's partnered with other things like the Regusep and the body fencing peptide that George talked about that are also going to be really beneficial with active acne. So it's incredibly well-rounded. It's so versatile, and it's usually my go-to product when someone says, I don't like my acne, I want one product. 99% of the time I'll go with daytime control.
Then we also have what is called nighttime control as well. So nighttime control, it can be utilized in a couple different ways, but the active ingredient that you're going to find in nighttime control, it's going to be a 5% benzoyl peroxide that's going to be encapsulated and also time released. So this form of benzoyl peroxide is pretty unique to be utilized in a topical product. Traditional benzoyl peroxide, it pretty much is going to kill the bacteria. It's an oxidant. It's also could potentially cause dryness in the skin, but it's really one dosage that's happening. Whereas the Circadia benzoyl peroxide that's going to be in here, it's a lower dosage, but since it's encapsulated and time released, it's going to give mini bursts of benzoyl peroxide while it's sitting on the skin. The other thing to note about the nighttime control is it's formulated at more of a larger molecular structure. So it's actually going to sit at the surface of the skin. So it's going to start to control bacteria from the surface working its way down. So think of this as almost like a mask type of setting where it's not going to really penetrate or absorb. It's really sitting at the surface of the skin. Same thing as our spot stop. Whenever we treat skin or acne lesions, we want to treat it from the surface going down on there as well. But some of the key benefits of the benzoyl peroxide, it's antibacterial, anti-inflammatory. It's also going to be very soothing on a client's skin. So even though this does mention that it's going to be a spot treat 2 to 3 times a week, this is all going to be dependent on the client's skin on there. So some clients may apply this almost like a mask type of setting where they'll apply a thin layer, almost like it's full face application, but not really getting so close to the eye area as well. Another thing, since it is going to be benzoyl peroxide, one thing I do want to mention, it is a form of peroxide, so it can lighten any type of areas. I personally haven't seen it lighten like pillowcases or anything like that, but some clients have.
And we name it nighttime control specifically because benzoyl peroxide should not be applied during the daytime. It can create a form of free radical damage called a reactive oxygen species. So we call them daytime control, nighttime control, because nighttime control cannot be used during the day, but daytime control can be used both AM and PM. So keep that in mind. I think George already mentioned that about daytime control, but just to reiterate, the nighttime control is not as versatile. It can only be applied at night. Okay, so the spot stop is another favorite of mine, especially for those who are suffering from, again, some of those hormonal breakouts along your menstrual cycle, or some of the lesions that are really uncomfortable and painful under the skin, because we do have an ingredient in here called quench tea, which is really going to help to reduce the stinging and the burning sensation. We also have things that are going to act a little bit more like an analgesic, so you'll hopefully forget that the lesion is there. It has a nice cooling effect, but we all have had those or experienced those lesions that are very uncomfortable. So it can also, a little side story, if you haven't heard this, we used to formulate the spot stop with a very, very powerful vasoconstrictor. It was along the same lines as fen-phen. So if you ever used phentermine when when it was still available as a weight loss drug, it was very successful, but it was actually giving people heart attacks because it was such a powerful vasoconstrictor. But it did wonders topically, and we have obviously since then phased that out and are using different ingredients, but this is so versatile for home care and for the treatment room. So if you have somebody and you've done some pretty aggressive extractions and they're really red and blotchy, you can apply the spot stop to those areas. Not only is it antibacterial and anti-inflammatory, but it can help to remove or reduce some of that redness, so your client doesn't have to leave and feel uncomfortable or self-conscious if they've got to go to the grocery store afterwards, or run a couple errands and they don't want to look super blotchy. It's also great, I think, as a home care mask. Obviously with Circadia, we don't have any at-home masks, but I like to apply this full face 2 to 3 times a week, and you can actually sleep in it, and it really can help to prevent some of the lesions from coming to a head, and it can also be a great anti-inflammatory. So this is a great product for, again, the treatment room post-extraction, but also for home care, and it's really good for your teen acne as well. So it's good for them to get all of these great ingredients. They feel that instant cooling sensation. A lot of people want to feel that it's working. And so they can use this and the white willow and juniper clearing mist as a good way to get their regimen started.
Caitlin, another place that I want to kind of mention where I use it as well, mosquito bites. You really wouldn't, the camphor that's going to be in there, and also kind of the analgesic effect. It really helps if you're in a pinch and you need something to relieve that discomfort, that inflammation, the itchiness from a mosquito bite. It's really good for that as well.
That is such a good point, George. I'm going to have to try that the next time I get, some people get more mosquito bites than other people. I don't know what it is. I think that there's some hormone that, makes you taste sweeter to mosquitoes. I don't know what it is, but some people get bit really, really bad. And I, unfortunately, am one of those people. So I'll definitely have to try the spot sup the next time that I get bit.
No, it's definitely great for that as well. So we do have a question right now, Caitlin. So does Circadia have any products that work as a disincrustation solution?
We don't have something that we label specifically as a deincrustation. What our recommendation would probably be is to use the PK neutralizing spray as your deincrustation. It's a high percentage sodium bicarb that can help to basically liquefy any excess sebum on the surface of the skin, and that can work as your deincrustation. You can also spray on the white willow and juniper clearing mist and then spot treat with the PK neutralizing spray in those specific areas that you needed a deincrustation. So those would be our options.
But the main one is definitely going to be that PK neutralizer. PK neutralizer is going to sit at a pH of about an 8 to an 8.8 on there. So it works really, really well with a disincrustation. And the other reason why I like it as a disincrustation is because it's in a spray form versus a gel. So I know a lot of the times with disincrustation, we're utilizing like some type of gauze or something like that. So I would apply it into the areas and then spray the skin down with it as well. And then it's easy to reapply as well, but it's great as a disincrustation. If you're also thinking of like iontophoresis, if you're going to utilize anything for that, any of the mists that Caitlin was mentioning, so like the white willow, the blueberry, those are great for it, for the iontophoresis, and also any of our serums, our clear serums will also be really good for that if you're doing a full entire kind of protocol with disincrustation and iontophoresis. So now we're going to get into some of the treatment products as well. So we're not going to really spend too much detail on these treatment products. We have separate webinars where we really discuss these products fully on there, but these are what we would recommend. So we would recommend our cocoa enzyme. So, we mentioned earlier about inflammation when you're treating an acne clientele. We mentioned there's two routes you can take. One would be something that's an anti-inflammatory treatment. So a cocoa enzyme would be for more of your inflamed type of acne clientele. Then we also mentioned if you have a lower grade acne, not a lot of inflammation, just those whiteheads, a little bit of blackheads as well. So the best product for that would be like our Dermafrost peel. So our Dermafrost peel is just going to be a salicylic acid. We have it in two different percentages. We have it in a 12.5 and we also have it in a 25% as well. Me personally, I always recommend just purchase the 12.5 unless you're more of an med spa and time is going to be you don't have much time to do full treatments. If you wanted the Dermafrost 12.5 to function like a 25, you would just apply 2 layers on there as well. And then the other treatment that we have that we like to really discuss is going to be our oxygen treatment. Caitlin, do you want to briefly go through this one?
Sure. So the oxygen is definitely our go-to treatment for treating acne, mainly because it's so powerful and it's so successful. Do we have the before and after pictures on this presentation?
Yeah, I'll jump right to this one.
Okay, so this is a before and after that we have that we were using the oxygen with. And granted, you're also seeing the after where we did a combination of oxygen firming peptide. And we'll kind of talk about that in a second. But the oxygen treatment we're using on this particular client is because you'll notice that she has a really kind of pebbly congestion. You see some inflammation, you see a lot of congestion underneath the skin, and you're noticing that that could possibly be some toxicity that is built up in her skin as well. But the oxygen is fantastic for her. We did, I think this was treating for 2 months. I'm not quite sure on that. I'll have to double check. But this was also being treated once a week. So you can absolutely treat with the oxygen once a week. we would suggest if you're going to do a combination of the cocoa enzyme and the oxygen treatment together, that those are only administered every other week. So your protocol, and we do suggest with acne to really get them to commit to a 4-week series of being treated every week. So you'd start with your cocoa enzyme oxygen, then the next week is just oxygen, cocoa enzyme oxygen, and then the last week, if it is this really more congested like acne, you would do oxygen followed by firming peptide. So the firming peptide, we won't get into too much detail, but basically it is going to create slight compression on the surface of the skin, and when the compression is released, it's going to allow for oxygenated blood to circulate through the skin, and then as it's going to go back to the heart, it was going to pull additional toxins out of the face. So it's a great way to help to detoxify the skin at the same time. And then the next before and after you'll notice is a completely different form of acne. We did start treating somebody like this with the chronopeptide. She's a perfect example of somebody who could do really, really well starting off with chronopeptide and starting slowly, and then also starting with treatments very gentle like the cocoa enzyme and the oxygen combination, and then gradually moving your way into things that are a little bit more aggressive like the dermafrost peel. But the oxygen is designed as to basically eliminate P. acne bacteria, which we talked about in the beginning as being something really important. And it's going to also be a vasoconstrictor, so it's going to help to eliminate some of that visible redness.
So the oxygen is really great. We have a full webinar on oxygen that's going to be on there as well. But some of the key benefits that the oxygen does have for your acne clientele is one of the biggest things is it's going to be vasoconstricting. So it's going to decrease facial redness onto a client's skin. Another key benefit, since it is a form of oxygen, it's also going to be antibacterial onto a client's skin as well. The other thing, let me go back a slide really quick. I'm going to show you kind of the steps on here. So this is kind of the steps of the oxygen. So you can do extractions in a couple different places if you're looking at our kind of full protocol. So if you're looking at a full oxygen protocol, you typically will do a double cleanse on a client's skin, then we really focus on some type of exfoliation. If you're going to exfoliate the skin, the exfoliant of choice that you'll want to use is going to be the cocoa enzyme. So we do recommend steam with all of our enzymes as well. So you'll steam that for a good 10-15 minutes. And then once you remove that enzyme from a client's skin, that's going to be a really good place to try and do some extractions as well. Get as many extractions as you possibly can. Then you'll want to start and do the actual oxygen treatment. When you start to do the oxygen treatment, and you see right here on the step 3 that's going to be here, you're going to utilize the step 3. That is what's going to neutralize out the oxygen before it has the potential to become a free radical. However, what's neutralizing out the oxygen is another sodium bicarbonate and water. So it's another pH between an 8 to an 8.8. So as soon as you remove the pH equalizer, that's also another great place to do extractions as well. And then of course you'll do the citric acid spray. That's just designed to re-pH the skin, and then you could do any of your finishing serums. If you're utilizing the oxygen for a acne clientele, I would typically recommend to use the finishing products like the Chronocom, even some daytime control on there, and then of course SPF would be ideal as well. So that kind of wraps up the presentation. We really just wanted to kind of briefly mention it's a new month. So as you guys know, Circadia has specials every single month. So I'm going to have Shauna kind of talk through some of these specials that we have going on.
Hi, George. Yes, we have the buy 4, get 1 free of the Full Circle Eye Repair. The Full Circle has the day and night formula in there. The emergency eye lift, which is going to be that instant gratification that you can recommend to your clients. I love using this in the back bar so they can see those results, and it's almost an instant purchase. The Myocyte Plus, which we all know and love, that one's going to be something great to use for prevention of wrinkles as well as building our dermal tissue from the inside out. There is no mix and match on them, so they are buy 4, get 1 free of one product. And if you do want to purchase them, you can contact any of your business development managers, or you can contact the corporate office to help you.
Yeah, and you know, one thing I do want to mention on this is we typically don't talk about Myocyte Plus as an eye product. However, that's typically the area that you apply it. So underneath the eyes, Myocyte Plus is going to be power pack type of ingredient as well. Another thing I did want to mention is, so, you know, now that we're back in the treatment room and we do have clients that are wearing kind of face masks now, it's a really good time to promote eye products because that's where we're looking at someone right away is straight to their eyes. So Shauna also created some different protocols. So I'll have her go through those for our back bar special as well.
Okay, so yes, we did create a protocol that's going to be focused more on the neck, the décolleté, and the eye area. So we do have those in protocol form. They were sent out in an email, so if you do not have those, you can definitely email me at shauna@circadia.com and I can get those protocols over to you. But it's going to start off with putting the firming peptide mask on the neck and décolleté area, and then you're going to move to the eye area. You're going to be layering the emergency eye lift with the marshmallow and snow over top, and then you're going to remove the firming peptide with our new mixture that we have with the lipid and the snow algae. And then you can finish with your finishing products, but we do have those protocols. So if you would like them, you can definitely email them to me. So we have that back bar kit that's going to be including the emergency eye lift 1 ounce, the firming peptide, which is both steps, our marshmallow whipped hydrating mask, the lipid replacing cleansing gel, and the snow algae. And we are putting in there the mini whisk because we do love that little mini whisk when it comes to mixing the firming peptide and the enzyme mask. And a little tip that I just recently learned from George, which I can't believe I've been living without it. But when you are using the firming peptide mask in the treatment room, get it ready about 5 to 10 minutes prior before you mix it and let the product sit. And when you go to mix it, all of the clumps and everything just mix really, really well together. So we do have that special for $1.99 and you're going to save $46 on that one.
Yes, that is honestly a game changer for mixing the firming peptide, because I don't know if any of you have tried this. When you mix it right away and you do like your first spin and half of the liquid is spilling out the side and then half the powder has puffed into your face. So it's a really good tip to just let it sit and let it start to dissolve a little bit and then mix it in together. And then it's perfect. The special is perfect for anyone who wants to try the firming peptide mask because the combination of the lipid replacing cleansing gel and the snow algae and spirulina cooling mask is the perfect combination to actually start to pull apart the bonds of the firming peptide mask, and it makes removal so easy. So you actually mix those two products together with a little bit of water and you paint it on the skin. You'll apply your hot towel on top of it and then it just removes as if it were a normal mask. You don't have to fight it. So this is such a great special because it's going to serve so many different purposes, but we really wanted to create something where, you know, if you've got your, you know, your nail techs are booked, your massage therapists in some states are booked, your stylists are all booked, but your estheticians are not really able to treat because they're forced to wear a mask, you can still get great results just focusing on the neck and the deck and then also on the eye area. So this is such a versatile special in that sense. Shauna's email address is shauna@circadia.com. And you can also email us at info@circadia.com as well. So as always, we went over just a little bit, but we appreciate everybody attending these Wednesday webinars. Again, if you had to jump off early, which clearly you wouldn't be on now, but if you want to listen to this again, it's going to be housed on our replay page, which is just circadia.com/replay. You'll also get an email that has the slides and also the recorded version. So again, thank you so much for joining us, and we hope you have a really good rest of your day. Thank you.